Hello, Dr. Rohit here. Welcome. Today, we are going to learn about platelet technology and try to answer some commonly asked questions. What is PRP or platelet-rich plasma therapy or plasma therapy? A small amount of blood is removed from a patient's veins and processed. Special cells called platelets in blood are extracted along with small amount of watery part of the blood called as plasma. This yellowish fluid has a higher concentration of platelets and is considered to have many healing properties. It is said to induce healing in many chronic problems like osteoarthritis of the knee ligament injury, partial rotator cuff tear of the shoulder, just to name a few. So, does PRP therapy or platelet-rich plasma therapy really work, or is it just hype? To understand this, one needs to first ask what happens when you get an injury and how does the wound heal. When you get a small cut, it starts bleeding. The blood, more specifically platelets, become activated and in turn activate the clotting process. They also cling to the clotting factors and form the clot. Platelets also produce many growth factors that help with the healing. So, we owe our healing potential primarily to platelets. Platelets are our healers. So, what's the answer to does PRP therapy work? The answer is if applied correctly, PRP therapy has excellent potential for healing, and it has led to a new ever evolving field of regenerative medicine. It has diverse applications from cosmetics and plastic surgery to cosmetic dentistry to orthopedics to spine surgery. But there is a small catch. When only applied correctly, it works. What does that mean? To understand this, we need to ask simple questions. Do platelets have wings? Do platelets have legs? What happens when platelets are injected in the wrong location or are injected in normal tissues? Nothing much. They are not activated and thus they are useless. They just get removed by immune cells. In short, the PRP has to be injected extremely precisely at the exact location of the pathology, preferably with USG guidance. What happens when platelets are not handled carefully? Well, they are delicate cells and can be destroyed with minor changes in their environment, rendering them useless again. So, does divide and rule work here? In other words, what if I inject half of the 3cc platelet-rich plasma in left limb and half in the right limb? Will that work? Well, platelets are like workers employed at a construction site. If you employ more workers, they will be more effective and they will do more work and will lead to more healing. If it is a major work, like a very big building, you need more workers. But even a large number of workers cannot do certain types of work, like building a bridge or something, which needs proper machinery. So they have their own limitations. Similarly, for a larger joint or more damage, you need a greater number of platelets, more quantity of PRP. There is a large space in the knee joint. Your PRP can get diluted and the platelets may not reach the damaged portion of the knee. Dose of platelets determines the outcome. For the osteoarthritis knee, higher quantity of platelets or higher dose of PRP extracted from at least 40 to 50 cc of blood injected in a single knee at one time will be more effective. than divided dose of small amount of PRP. PRP can also be used for low back pain caused by a tear of the outer part of the disc called as the annular tear. Even better than just injection of PRP is to remove all the fragments trapped in the inflamed edges of the annular tear by spinal endoscope, and then use platelet-rich fibrin plug, that is PRF, instead of PRP for better healing of the annulus. So what's the conclusion? If done properly and in adequate dosage, PRP is an excellent choice for many ailments. Thanks for watching. See you in my next video. Bye. Have a nice day.